Hi, welcome to the channel. I'm Jonnie. I'm a travel nurse, and I want to use my channel to just kind of get a message out there today, because I feel like as this pandemic, as this virus kind of ramps back up again, I feel like everything that the nursing healthcare profession went through over the past year and a couple months, I feel like there's a whole lot of nurses out there that really can't do it again for another 16 months or another year. There's got to be somebody speaking out. There's got to be somewhere we got to draw the line. And what I'm talking about, so I built out this ProMaster for travel nursing. I wasn't going to do that for a couple of years. My wife graduated nursing school in February, and we were going to travel nurse together. When the pandemic started, I was a charge nurse in the emergency room. Every single day I went to work, something was different. The rules were different. Oh, we're not going to do it like that anymore. We're working out of the tent. We're not working out of the tent. Family can't come back. Family can come back. One person can come back. Two parents can come back. They can't have a visitor. They can't have a visitor. It was exhausting. I've been there 18 years. I was just really, I lost a coworker, not necessarily to COVID, but suddenly we had friends that were off with side effects from the virus that still weren't back to work. I was scared. I was scared that it was going to happen to me and that I wasn't going to have tomorrow. I wasn't going to be able to enjoy the golden years. So I put everything that I had, every ounce of energy I had, building out my ProMaster so that I could get on the road. I left my wife at home. She's getting experience, and then she's going to join me. But I see this virus ramping back up again. It's worse in my hometown, which is exactly why I wanted to do this, so that I don't want to go to hotspots. I don't want to make $5,000 a week. The less I make in the most enjoyable atmosphere is what I want. On my days off, I don't want to be around people screaming at me like it's my fault that they can't come back and see their loved one. I am sick of family members and loved ones calling, screaming over the phone in the waiting room, demanding to talk to their nurse, screaming at us because of the policy. It's been like this for a year and a half. I don't understand how there's people out there still screaming at the nurses. I don't understand how you got COVID, you took it home to your 39-year-old wife, she comes into the hospital, and you're mad because you can't come see her. I'm like it's exhausting. It's not your nurse's fault that you can't come into the hospital. You cannot call and demand to talk to your family member's nurse and scream at us. Like, it's exhausting. Nursing is supposed to be the #1 trusted profession for how many years? How is it that there's so many people out there calling their loved ones in the hospital, demanding to talk to the nurse so that you can yell at us because you left to go smoke and we won't let you back in, and now it's our fault? It's exhausting. And there's so many people out there. I'm not getting the shot. I'm not getting rat poison. I'm not getting a chip in me. That's great. That's wonderful. Don't get it. It's going to be mandatory for how many healthcare workers? We don't get a choice. I wanted it. I don't want these side effects that people have that prevent them from going back to work, that prevent them from living every day to their fullest. I don't want palpitations. I don't want the anxiety that comes along with worrying that I'm going to get it. I'm like exhausted, not just taking care of the patients, but it's honestly the family members. So if you're one of those family members, if you're one of those visitors, like, you have to understand that It's upsetting, but we've got to treat our nurses better, because so many nurses that were affected with the first round, the first, I call it the first, whatever, the surge, the first year, just the thought of going through this again, just the thought of cities going on lockdown, where I live, it's mandatory mask again. Just the thought of all that, knowing that we're going to have to, as healthcare workers, go through what we just got done going through, is exhausting. So when you're so upset that saliva leaves your mouth and hits a nurse, like, you need to back up. Like, go regroup. You know, I don't know, but as healthcare professionals, we're gonna become exhausted. People are gonna leave the field, and then who's gonna take care of the loved ones? So I just ask you, as a society, as possibly a loved one, we're at the bedside taking care of your family member. We're at the bedside with them, possibly as they're dying, because you can't come in. You have to treat us better. The system has to improve. People have got to quit yelling at the healthcare workers. And that's what I'm here to say. That's the message that I want to share. I hope you share it out. I hope, like, if you know somebody that's in the hospital, just take a breath, call the nurse, listen to what they say. Honestly, every phone call that we have to take is taking us away from your family member. I mean, if we're going to go through this again, we've got to do better. So I've got 7 days off. I'm going to go to the mountains where I have no cell service. I have no internet. And I'm going to take a break. So be nice. Be good out there. Take a deep breath.